This study aims to update and compare perioperative outcomes and complications of intracorporeal urinary diversion, ICUD, and extracorporeal urinary diversion, ECUD, following robot-assisted radical cystectomy from the International Robotic Cystectomy Consortium. We retrospectively reviewed 2,125 patients from 26 institutions where intracorporeal and extracorporeal approaches were compared. 51% of patients underwent intracorporeal diversion. Utilization of intracorporeal diversion increased from 9% of all urinary diversions in 2005 to 97% in 2016, at a rate of 11% per year. This increase has been primarily demonstrated for intracorporeal ileal conduits that increased from 2% to 81%, and to a lesser extent for intracorporeal neobladders that increased from 7% to 17% over the same period. European institutions adopted intracorporeal diversion earlier in their robotic experience when compared to U.S. institutions. Intracorporeal diversion patients demonstrated shorter operative times, less blood loss, fewer blood transfusions, and more high-grade complications. Complications after intracorporeal diversion decreased significantly over time. A higher annual cystectomy volume, more recent date of robot-assisted radical cystectomy, and a lower ASA score were associated with receiving intracorporeal diversion. Older age, annual cystectomy volume, recent date of robot-assisted radical cystectomy, and receiving an intracorporeal diversion were associated with shorter operative times. Higher BMI, higher ASA score, and receiving a neobladder were associated with longer operative time. History of prior abdominal surgery was the only significant factor associated with high-grade complication. In conclusion, utilization of intracorporeal diversion has increased over the past decade, especially at higher volume institutions. More surgeons are incorporating intracorporeal diversion as part of their robot-assisted radical cystectomy with standardization and evolution of the technique.